Good day to all of our English-speaking community in the island. My apologies for not having coming back to you earlier. I realize that it's been some time since we've discussed matters in English, but as you also might have realized, things have been quite hectic. So what's going on now? You might have already heard or taken notice of the fact that certain measures have been intensified. Why is that? First of all, we tried, as of last week, to try to de-escalate certain measures because from the point of view that we know that COVID-19 is here to stay and that we need to find measures how to live with it in a more normalized fashion, saying thereby that if we, in any case, focus on the things that are important, keep your distance if you're not sure, try to avoid big groups, agglomerations of bigger groups of people together, and also taking care and taking heed of all of your family members or known people who are in the vulnerable groups, which means the elderly, people who have chronic disease, people who have problems with their immunity because they're using certain medicines because of disease, etc. So, what happened when we relaxed certain measures? We saw immediately afterwards, I'm not saying it's because of that, maybe it was in the making, probably was already some time before, that the numbers increased. And there was an increasing trend that kept going on, which you can understand. If a bigger group of people gets detected on one day, every single one of that group can, him or herself, infect others around that same person. So if the group that you detect is bigger, the amount of people that can be infected secondarily also becomes bigger. So your trend will go up. This is what happens. That's one part of it. The other part of it, we saw clusters within certain companies, organizations, and especially noteworthy in the hospital itself and other care organizations. And what does that mean? If we know that there are certain groups of people that get infected there, especially in the hospital, and that affects your working force in the hospital, it means that your total capacity for care within that hospital has also been reduced. And if that happens, then we have to go back to measures at an earlier stage than what we would have otherwise, because your capacity has diminished, not because you don't have the beds, but because in a short period of time, you have less nursing care, especially people, healthcare attendants there to help you when you need it. And not only for COVID-related disease, but for all non-COVID related issues as well, especially emergency issues that keep on coming in if we leave the movements the way they are right now at this moment. So it's especially this factor that is the cause of us having to take measures again to protect our capacity for healthcare for all of us together. So what are these measures? I'm not going to mention all of them, but basically it's about a couple of things. That curfew has been intensified. It starts now at 9 o'clock as of the 16th of November, up to 4:30 in the morning. And it means that also the opening times of certain establishments have been adapted to that state to allow people to be home by 9 o'clock in the evening. So the curfew has been intensified. That's one thing. The second thing is that we're telling people that if you're going, what we've been telling you all along, you don't need to wear a mask if you walk outside, etc. But if you come into places that are confined areas, that there are a lot of people relatively in there, it will be advisable to wear a mask. What we're telling you now is it's not so voluntary anymore. Now it has become obligatory in certain public entities, public spaces, that you do need to wear a mask. What about schools? Schools, adults need to wear masks. The children do not. Why not? Because we know that the children don't add on to the spread. If we look at the figures that we have for Curaçao, and I've showed them in the couple of weeks that passed a few times already, they hardly add on to the spread. They're not the source. The elderly are more the source. They don't spread it among each other, the kids. And if they even do, it doesn't necessarily happen in school because they also have contacts with each other outside of the school. So adults coming to the school, they need to wear a mask. The teachers, not when they're teaching, because that's difficult when they're wearing, but they need to keep distance. But the teachers, when they are in meetings with each other, when they are meeting others, when they are meeting elderly or meeting the parents of the students in school, people who are in administrative functions in school, people who are in the keeping up or upkeep of the school, all of those people who are working there, they do need to wear masks. So wearing masks has become a more obligatory fashion. Curfew has been intensified. Those are the important things. And what we're also saying is bigger groups of people have been trying to be diminished. You cannot come together with 4 or more people, or more than 4 people. Also not on beaches if you're not from the same household. So these are measures that are taken to try to reduce the amount of people that come into contact with each other, to try to enforce keeping distance, wear more protective gear, limit the movements on the street so you have less acute care like car accidents, traumas, etc., to provide for them, to diminish for them to come and put a burden on the hospital care. These are the reasons we're taking those measures. There's something else we want to say to you, is we're seeing that different companies, stores, etc., they are of their own accord sending people to take tests. This is slightly contradictory. If we test close contacts. If you're a close contact, we test you so that we know that you haven't been able to infect anybody else beforehand, and then we only have to take care of you if you do become positive later. So this is if you test negative as a close contact, then we don't need to go back and do contact tracing with you. But it isn't advisable if you're just going to test everybody random that works in your entire company, as has happened on the island. What you're doing is you're placing a burden on the resources that we have and that we might need for really more important things. And second, you're creating false security. You're telling people if they test negative that everything is fine, which isn't necessarily so. You may be asymptomatic and not have enough viral loads to be able to detect at that point in time. It doesn't mean that you are not infected yet. You cannot say that. So it gives you a false sense of security, and it's also contradictory in the sense that if you do think you're a close contact, regardless what the outcome is, you need to be in quarantine anyway. So if you do test people, but then tell them that they go to work, that's a bad message. That's the wrong thing to do. So that's one thing that goes wrong with companies. The second thing is, contrary to the advice of the Public Health Department, once we declared you that you've been cured of COVID because you have been in isolation for at least a week and also more than 3 days, consecutive days, that you have no symptoms, you're COVID-free, you have been cured. It makes no sense to keep on testing these people because we know that the test might come out positive because the PCR is too sensitive. It even detects dead virus. So if you keep on testing, which some companies demand, that you have a negative test prior to for them letting you into the company at all, it might be so that you have to keep these people home for up to a couple of months. It might be so you have to test them who knows how long. That's counterproductive. Again, it takes resources up. Again, it costs a lot of money for no good reason. It's no good for the person. It's no good for you. It makes absolutely no sense. So please try to avoid these things and don't do this anymore because it's not a good thing. It's not a good thing for public health, and it's also giving you false security. So please try to refrain from these type of activities that are only detrimental to the public health and the efforts as such. Last thing, remember, that's the most important. Keep distance, avoid big groups of people, and please help us trying to protect the people who are more vulnerable. Thank you very much.